Health Minister Aaron Motsoaledi's recent announcement of a 1.3 billion rand healthcare boost, including plans to build 6 new academic hospitals, has sparked some hope that government is getting its ducks in a row, if you will, in terms of preparation for the implementation of the National Health Insurance. Let's get the view now of its Social Security Systems Chair, Professor Alex van den Heever. A very good evening to you, Prof. Always good to have you on SABC News. So, 6 new hospitals that are going to be built according to the Minister. Is this a new plan, and how much relief would they bring to the public healthcare system?
Well, it doesn't appear to be a new plan. The original plan in 2009-10 was to build 5 new hospitals, academic hospitals, of which 3 would be replacing existing facilities, and there would be 2 additional hospitals. Theoretically, they were being fast-tracked and directly working under the minister, which was Minister Motsoaledi at the time, but they never materialized. And now there's an indication of 6 hospitals. It appears that probably at least 5 of them will be the same hospitals that were identified in 2009-10. But it's not particularly clear what facilities these will be. There is a hospital in Limpopo, that's the academic hospital that's being built, but aside from that, the question is really whether these facilities are just going to be suggested in announced and never really occur in the future. There is a need to build new facilities on an ongoing basis in certain areas where population growth is changing quite significantly, like the Western Cape and Gauteng and parts of Mpumalanga. But it's unclear what these plans are, and he's indicated he will announce it at his budget speech, and that's when we will have further detail. But it's important to note that the original 5 academic hospitals form part of the 10-point plan that was announced in 2009, but never materialized.
And why did the plan not materialize, Prof?
Well, I don't think that the National Department is very good at delivering, and I think that it's important to note that there are differences between how provinces deliver and how the National Department delivers. So the attempt was made to drive the hospital build projects through the National Department, and that may have been one of the reasons why it stalled. But it's very unclear. What was very clear at the time was that there was a lot of impetus put behind it, but it just never happened. They were meant to be public-private partnerships, and they have a set of quite stringent requirements to be established, and it's possible that they were unable or lacked the capability to comply with those requirements and then just gave up at some point. But building hospitals, South Africa knows how to build hospitals. Right. The question is the money, the question is how they will be, where the money will come from, and then ultimately how they will be run and whether or not there's staff for them. Where they're replacing existing facilities, that's where the staff already is. It won't require a new staff. But if there are new facilities, there will be a big question mark over where the staff will come from.
And we've been taking viewer comments throughout the evening on the comments that were made by the Health Minister regarding the construction of these six hospitals. And some of the people we've been hearing from have basically been saying, why do we need to build 6 new hospitals right now when the existing ones, in some cases, are in such a sorry state, if you will? Is that a fair question to ask of government?
I think it is. I mean, but if you're building new facilities, it should be part of a strategy rather than just trying to announce new hospitals. So a strategy might be that you are changing the configuration of the hospital system. So you're building, let's say, more generalist hospitals closer to the population, as opposed to building new academic facilities. Academic facilities can be important because they're part of training. But our issue here let's say, in the provinces where you have the academic facilities is their maintenance has been extremely poor in Gauteng, in Eastern Cape, in KwaZulu-Natal. And the question really is how you're running those facilities. It's not whether or not you need additional facilities. So existing facilities, if their lifts aren't working, if there is an inconsistency in the upgrading of those hospitals because of a disconnect between the public works departments in the province and the actual people running the facilities, you're going to have these ongoing infrastructure problems. If you've got significant corruption, of which there is in Gauteng, in KwaZulu-Natal, in Eastern Cape, in Northern Cape, if you've got that, it's going to hinder the implementation of, or just the maintenance expenditure and the upkeep of existing facilities.
And in terms of the broader NHI plan, so for it to succeed, you do need state-of-the-art facilities that are able to cater for every South African who needs healthcare. If these 6 hospitals do come online, how quickly would we need them to be built in order to help the broader plan? And how much would they help?
Well, they won't help much. The key problem with the National Health Insurance proposal is that they are contingent on a substantial tax increase to substitute for medical scheme contributions and to funnel all funding through general taxes and through a single fund. That is the core problem there. It's not hindered by whether or not these facilities are running properly. You upgrade facilities and you manage the supply side of the health system because that's the right thing to do for a health system, not to implement an NHI. National Treasury has already indicated don't bank on anything happening anytime soon. There are just no funds for the NHI specific proposals. But there should be funds for incremental adjustments to the health system and improvements, including what should be done, which is governance improvements within the provinces to run these facilities better, because that's actually the real problem that we have. They are not being properly run.
Professor Alex van den Heever, good to talk to you this evening on what is going to be a very important issue, no doubt, going forward, especially ahead of the budget vote that's going to be given or delivered by Minister Aaron Motsoaledi before Parliament. For now, thank you very much for your time, Professor.